Hi, my name is Ron Royer, and I'll be demonstrating nasogastric tube insertion, the irrigation of it, and then also the removal. I'll start by panning the area. Okay, the first thing we want to do after we've done our pre-steps is check the physician's order, make sure that this is appropriate. Head elevation, we want this approximately 30 to 90 degrees or so. But we want to do an assessment to listen to his bowel sounds and to see if there's any activity or lack of activity. So we want to do that the first thing. We want to check the nasal area to see if there's any problems there with patency. If there's been any septal deviation, for example, polyps, nasal surgery in the past. So we want to ask some questions there. We'll be explaining the procedure to our patient and to help them feel comfortable with this procedure. So the first thing we want to do is check each nostril, make sure we want to take the one with the best passage. And so we'll go with the left nostril. Now the first thing we want to do is take our NgTube and measure the distance, because we want to make sure that it gets down into the stomach. So the first thing we want to do is start at the tip of the nose, to the earlobe, and then over the xiphoid process on the sternum. So that's approximately where we want to be. So we'll take a strip of tape and mark that, so that when we start inserting it, we'll insert it down to that piece of the tape. Now you want to make sure that, and by the way, this is for gastric reflux, you want to make sure you put it in the right end here. But we want to have a basin in case he gets sick, and so I'm going to have some towels that are going to be handy. If he's, of course, awake, he could hold on to it and have it close by. So after the assessment, we've determined that this is going to work. We want to make sure that we get some lubricant on here to make it pass easier. So we'll go ahead and apply some lubricant here. And we'll put that in approximately 3 to 4 inches. And there will be a gag reflex eventually. And we want to slow down there because you don't want him to be too uncomfortable. It's an uncomfortable enough process. So we'll just hold it there for a while. If we had an assistant, we could have that person give some water. Might want some water, we'll give some water here. Okay, so he's so far tolerating it. Now I'll explain to him that when I insert the tube, I'll have him swallow, so I'll be directing him to swallow. So swallow, for example, swallow, 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 swallow. And so far he's doing very good. Swallow, 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 swallow. He's doing good. If he gets uncomfortable, you could slow down and not go so fast. So we get it down here to the tape then. And we'll go ahead and apply a little bit of tape to the top where we'll secure the tube a little bit. And then we'll do the placement test, make sure it's placed in the appropriate area. Because you want to make sure that the tube is placed in the stomach and not in the lungs. So we'll temporarily place that in that area there. Okay, so when we're testing the placement, what we want to do is take 5 to 10 cc's of air, and we want to listen for a swooshing sound. So we'll go ahead and put our stethoscope on, apply this, and we'll instill the air and we'll listen for a swoosh. So we hear a swoosh, which is good. Once we hear the swoosh, we know that we got the placement in the correct place. For what we want to do is have it aspirate 5 cc's, and we'll take a look at the pH to make sure that we've got enough, or to make sure that it's in the stomach. We want 5 cc's to test it. So we'll go ahead and aspirate 5 cc's. And for demonstration purposes, we'll go ahead and test up here, take a look at the test, see what color it is, look at the bottle. As long as it's between 1 and 4, we're okay. Anything near 6, then we're looking at probably the lungs and we'll have to replace it. Okay, so he's good. We've got it in the stomach. So the next thing we want to do, since we've got a good placement, is go ahead and secure the tape to the tube. So we'll go ahead and secure this. And we're all set here. And then we'll hook this up to the suction. So the suction tube over here, plug it into the suction. We go ahead and turn it on. We're watching him, seeing how he's tolerating this process. He seems to be doing fine. The suction tube's on. Now we want to make sure that the tube is suctioning the contents, the fluids in the stomach, and sometimes it gets against the wall of the lung and it won't suction. So what we want to do is take some air, again 5 to 10 cc's of air, and instill that to push it away from the side of the lungs. So we're okay there. There. And we'll put the gastric reflux valve back in. So everything's going fine. It's suctioning, it's away from the wall, he's tolerating, seems to be doing fine. The next step, doctor wants it irrigated and removed. So the next step is to do in the irrigation is to do an assessment. So we would again listen to the bowel sounds, see if there's any activities, lots of activity, seems to be doing well. We want to double check and make sure that the tube is in the correct place. So we go ahead and turn off the pump, unhook the section here, take a new tube, of course, new syringe, and the first thing you want to do is inject 5 to 10 cc's of air. We would listen for the swooshing sound with our stethoscope. We hear the swooshing sound. So next thing we want to do is take and aspirate 5 cc's or so of aspirate. Check and see again with the pH strip to see what kind of reading we get, 0 to 4 or so. Anything above 6, of course, is in the lungs. Next we take a new syringe. Syringe, and things are going fine here. So we're going to remove it. We've got the pump disconnected, we aspirated, things are going fine. We've double checked, make sure it's in the cavity there. We want to take and we want to clean the tube out. So we want to put air and water into this tube. So what we need to do is we take 10 cc's of water, and then we take another 10 cc's, total of 20 cc's of air. So you want 10 cc's of water, 10 cc's of air. Holding this up directly, we'll go ahead and instill the water, which will flush the tube, and the air, flush, he seems to be tolerating it. And tap water is fine, although some places will talk about having saline solution. And you can leave the syringe right in there because we're going to remove it now. He seems to be doing fine, tolerating the process. Go ahead and lay this down here. We'll disconnect this from the nose here. And now what we'll do is have him take a deep breath. So I'll have him take a deep breath, and then hand over hand, we'll go ahead and take it out. And we'll go ahead and set this down here. Put this away. Remove our gloves. Take this to the garbage, of course. And then all the post steps, of course. And the last thing is we want to document and do our DART. And that's the end of this demonstration for nasal tube insertion.